Doctor, what is a Colles fracture? A Colles fracture is the name given to a fracture across the lower end of the radius about 1 to 1/2 inch above the wrist joint. Doctor, is it caused frequently by a fall on the outstretched hand? That is correct. Or by the backfiring of a motor engine? Well, that is another form of Colles fracture. If the deformity is fully corrected, the result is usually good, but if the fracture unites with any appreciable deformity of the wrist, the result may be extremely bad and the grip very seriously and permanently weakened. Doctor, is it true that the hand is usually displaced backwards? Yes, backwards and outwards towards the thumb side. Doctor, what is the disability in a Colles fracture? Well, it is a total of 6 to 8 weeks. It may be partial as to 6 to 8 weeks. And does it affect the carpus? The carpus, or wrist, is directly affected by the blow on the small bones of the carpus, commonly due to backfiring of a motor car engine. Doctor, let's go into the symptoms. Well, the symptoms are simply pain, swelling, and deformity of the hand near the wrist, weakness of the grip, pain on movement of the wrist. X-ray examination is frequently the only means of diagnosis. Doctor, what are the sequelae? The sequelae are nil, apart from persistent weakness of the grip. Doctor, what is the cause of a direct blow to the phalanx? Well, it can be a fracture, but it's not necessarily so. What are the symptoms? The symptoms are loss of use in the digit, swelling, pain, and other signs of fracture. And what is the sequelae, doctor? Owing to the frequency with which the fracture involves one of the joints of the fingers or toes, permanent stiffness is a common result. In the case of the great toe, this may result in a permanent limp. In the case of the finger, in permanent slight weakness of the grip. In the stiffness, if the stiffness is complete, it is frequently advisable to amputate the finger. Doctor, this is a serious injury, is it, to the pelvis? Well, it is for 3 reasons. What are those 3 reasons, doctor? The violence necessary to fracture the pelvis is very great, and the degree of shock is usually produced and profound. Doctor, can there be damage to the pelvic organs? Yes, the rectum, the bladder, the urethra are frequently caused or fractured at the same time. Doctor, as the whole weight of the body is borne by the pelvis, does the pain and incapacity resulting therefrom result in a very long, prolonged condition? Well, the duration and disability are total 6 months, partial, indefinite. Doctor, what about a fracture to the neck of the femur or the thigh? Is that important? Yes, it is important. An important fracture owing to its frequent occurrence in elderly people as the result of slight violence. Doctor, may it be caused by a fall on the side of the hip joint or even by a twist of the leg on old people? That is true. The disability resulting from it may be slight or severe according to the amount of displacement, owing to its occurrence in elderly people who are prone to get congestion of the lungs. If long, prolonged, and confined to bed, it may be indirectly fatal. Doctor, what is the period of disability in favorable cases? The total is 3 to 6 months. The partial is also 3 to 6 months. Doctor, what is the cause which may result in a fracture of the patella? Well, that is a direct violence when the fracture is usually comminuted. It is unusual. It is caused by a sudden muscular strain, i.e. indirect violence. The fracture is transverse and considerable separation of the fragments is present. This necessitates operation for wiring the fragments together. Doctor, is there a period of disability? Yes, there is. The total is 6 to 8 weeks. Doctor, permanent weakness of the knee joint results, does it not? Well, if the fragments are not wired separately and fibrous union occurs. How's that?
That's good. How fast was that?
165.